appreciate it, and thank y'all all for staying. This is the last session of the day, so I know y'all are tired of sitting all day, but I appreciate you staying. What I'm going to be talking about today is really from a project management perspective of the E-Link project, or the BTOP project as we call it. So as we go through this, one of the things that I do want to point out is Brian, and I don't know if he's still here or gone or not, but he was here right before this session, and he has done a great job of developing services. What our project is all about is really building an infrastructure or a conduit throughout the state. That's the objective. So all of our members that are part of this network, we're encouraging them to actually develop services that they can offer to other members on this network. So with that, we'll just keep going here. So today, I'm going to be talking about the grant, give you some background on the grant and the status of the grant. We're going to review the expected benefits for Arkansas, and we're going to discuss, obviously, the project management strategy and timeline. We had a very tight timeline, as you'll see. And I'm just going to share some lessons that we've learned as we've gone through this journey. I do want to point out that the grant, the main grant, was from it was Broadband USA, or the Broadband Technology Opportunities Program, which was funded by ARA, and then also a secondary grant, which was the FCC Rural Health Pilot Program. And you'll see how those fit together here in a minute. When this was envisioned, and I do want to make sure that y'all understand, I didn't come on board until January 2011, and that's when my team came on board. But before that, there was a lot of work that was done by the University of Arkansas Medical Sciences group, and particularly the Center of Distance Health, and Dr. Curtis Lowry. Without their leadership, we wouldn't be where we are today. So this was all brought about because of their diligence and hard work and their vision that they saw and the opportunities that were available to the citizens of Arkansas. So as we went forward, this was really a collaborative effort, and we worked with the Arkansas Telehealth Network, and some of you may know that group as ADAM. ADAM is made up of several healthcare providers throughout the state, and I'll show you some of those in a minute. And then also our subrecipient is ARON, and ARON is the fiber provision for the university system, higher ed. So our objective was to bring both of these networks together and create this network throughout the state. Here are just some of the ADAM memberships: hospitals, centers of aging, county health clinics, mental health centers, human development centers, community health centers, public libraries, ambulances, and home health agencies. All of those are participating in this initiative. And then ARON obviously supports the two-year colleges and the four-year colleges. So with the BTOP grant, we were awarded $102 million. That's a lot of money. And when we first started out, I thought, oh my gosh, how are we ever going to spend all that money? Well, you know, we wish we had another $102 million at this point. But unfortunately, we don't. And the FCC Pilot Award was $4.2 million. So what you'll see here on this slide is really how the BTOP award is broken out as far as where the money went in this grant and our project. And if you'll look down where it says the $24 million connectivity lease charges, actually we would add the 4.2 to that, because that's where the FCC pilot funding actually lands up if you were looking at this as a whole. So obviously this was a vision, as I said. There are lots of benefits, and I will tell you one thing, that this group that has been working on this has been very, very passionate about this. I'm from a small town in Arkansas. I grew up there, And I have seen, we were fortunate because we had some of the younger generation that grew up, went to college, went to med school, came back. They wanted to live in a small town, so they were there. So in this small town that I was from, we really didn't have a shortage in family practice physicians, but we did in specialty physicians. So we see that everywhere. But from a standpoint of healthcare, we are actually, right now, we have 73 out of our 75 counties that are medically underserved within Arkansas. That's pretty staggering. And then we also have a significant healthcare provider shortage, and y'all have seen that in the paper just recently. I think it was this week where they were talking about a study that just recently been done. And then also, unfortunately, we're one of the worst overall health entities or states in the U.S. So how do we see this helping from healthcare? Obviously, we see this as an access to specialists from every point of the state for consultation. We also see it for for other clinical consultations. Potential new revenue via these services, sharing of data. This network actually allows the sharing of data to take care of the patients. Trauma outcomes, and keeps the patient in the community. It's not our idea that every patient has to leave rural Arkansas and come to Little Rock, but that's pretty much what happens today. So this will impact our patients and the communities that are in rural Arkansas to help those patients stay in those areas. I don't know if y'all know, but it's very depressing to me when I go back to my hometown and I see the downtown area really kind of drying up. And that's because of not only are they losing in health care, or they can't provide the health care, industry won't move in, and also in education. So we see this as a very important benefit to the citizens of Arkansas. Higher education. Obviously, higher education, there's a lot of opportunities there for collaborating, for resources, sharing of professors, sharing throughout the state. I was able to attend one of the Morrilton two-year college kickoffs for the E-Link, and they were so excited. All the teachers at that institution were so excited about what this would bring. I mean, they were talking about, I can do this, and I can do that, and I can do this, which was amazing. So there's a lot of excitement. And, the way I look at this is just your imagination is your only limitation. So there's lots of opportunities. It also, as I mentioned earlier, will help with workforce-specific training. I wasn't aware of that until I started getting involved with this grant, that our two-year colleges in particular are really focused on workforce training for the specific area. That is really will impact those small rural areas and keep them thriving for years to come. So this is not just about a network that will, that just has X's and O's traveling across it, but this is about the survival of communities in the rural areas. Pardon me. Libraries, we actually were able to put some of these video units in the libraries throughout the state, and I've seen some of those libraries participating in some of the UAMS education programs that are there. So these were actually put in there for that reason, but also to give access to those communities for the public so that they could come in and maybe even participate in research and things of that nature. Job opportunities, with this we put a lot of public PCs. I think there were 290 public PCs that we put out into all of these areas. And those were put there specifically for public access so that they can go on, they can do research, they can look up things that they might not have access to, they can participate in clinical trials, they can apply for jobs, all of those things that they might not have an opportunity to participate in. Learning opportunities is also one of those things that is very important. Public safety, I'm getting behind now. Public safety is another one. This portion that's riding over this network, or will be riding over the network, is the hospital emergency preparedness network that's already set up. This was done way back in the first part of 2000, I think 2000, 2001. And so what this does is it allows very fast and efficient ways to communicate with all of the hospitals, all the first responders throughout the state. So that it actually will be riding over this network. It also will help to provide continuing education for first responders. Again, if they don't have to leave their area and they can get their continuing education hours, this is a great benefit because, as you know, in the rural areas, there's not a lot of those extra bodies out there that can just leave and be gone for a day or two. We're also trialing an opportunity where there will be video in the ambulance and be able to actually communicate live with the physicians in the ED, which is kind of exciting. All of a sudden, the physician, the emergency room physician is actually in the ambulance virtually with the patient and can see what's going on and can direct that care while the patient is en route to the emergency room. Then, of course, in higher education, there's always a need for research. And in the medical setting, there's a need to continue research so that we can continue to find answers to things that we don't have today. So research, clinical trials, this allows an opportunity for more participation and also even additional participation where people were not able, we were not able to gather information from the rural areas. So this makes the outcomes more valid than what we've been able to achieve in the past. So what were our grant funding deliverables? And I will have to tell you that this grant came about in August. I think we were notified August the 27th, 2010. It actually started August the 1st, 2010, so we were already a month behind at that point. There was a lot of, obviously, ramp-up stuff that had to go on. And by the end of that year, the CDH group, the group that had been involved, had identified who they needed for the team for implementing this and managing the project. And so we were all ready to begin 2011 when that started. But our main deliverables were we were going to add substantial bandwidth upgrades to all of our community anchor institutions throughout the state. It was going to be a significant network expansion for, remember, the fiber backbone that Auron's providing. And the infrastructure upgrade, we were able to upgrade the video infrastructure that we have through this grant to allow for all of these sites to be included and to be switched and to be secure. So all of this information, all of this was part of the deliverables. And then obviously the interactive video. Brian mentioned that they have some of our carts in his sites. Putting bandwidth out there is one thing, but you also have to have the instruments to do telemedicine or to do video conferencing or whatever to make that all work. And then I mentioned a minute ago that we have public computers for internet access. We did, that was one of the objectives and deliverables that was part of this grant. So this is kind of a timeline that we use. It kind of keeps us on track. And so as I mentioned, in 2010, that was kind of a ramp up. The award was received, a lot of startup. Oh my God, we really got this grant. What do we do now? And the other thing is we better hurry because we're running out of time already. The environmental assessment, we had to do an environmental assessment for all these sites. That's part of the grant requirement, had started. And then also talking about the network design. And the design was really set up so that as we go out, and you'll see the map here in a little bit, we wanted to look at the future. In the future, we wanted to make sure that as other people became or needed to be added on or wanted to be added onto this network, they didn't have a backhaul all the way to Little Rock. They could actually hit the network closer to their point of presence than all the way back to Little Rock. So you'll see that in the design. In 2011, we finally did receive the Fonzie, which is the approval from the environmental assessment. It's called Findings of No Significant Impact. That's right. It's been so long ago. And we got that in June of 2011. And until we got that, we really couldn't do anything as far as implementation. We could prepare. And we spent a lot of time that year developing requests for proposals, looking at the network design, developing databases, doing some CAI outreach, talking about how we were going to deploy this. And we did have to change it because one of the things, we thought we could just do everything at one time. What we ended up doing was actually deploying the equipment in 2 phases because of the timeline again. We had some of our sites that already had broadband. And so we were able to go ahead and get the equipment to those sites where they could already start using it with their existing broadband before we were able to upgrade. And then phase 2, we actually included the equipment for those sites that had no broadband and there was going to be new broadband added. So 2011 was very, very busy. We also had to develop memos of agreements with all the sites, get those signed, get those processed through UAMS. So lots of activities during 2011. And then in 2012, talked about that's when we installed the infrastructure equipment that runs the network. Phase 2 equipment was deployed. Broadband installation continued during that time, or actually started during that time. And the network hub connectivity was installed. The CAI training continued. We just, kept going and going in that year, in 2012. It was busy as well. And here we are in 2013. The grant actually, conclusion date is July 31st, 2013. So as you can see, we had about 2.5 years to complete this entire grant. So it was very aggressive. And sometimes we would just bang our heads against the wall. I have a sign in my office that has this big target, and it says just bang your head here. so every once in a while, everybody comes in and bangs their heads for a little bit. But anyway, I've had a great group to work with. And this is the group, the E-Link team that has been involved in this from day one. Some of them are here today. Brenda's here, and Melinda's here. And Terry's here that does a lot of the training that's going on. So we couldn't have done it without this team in the short time frame that we were going forward. So we learned a lot of lessons, and I'm sure we're not through learning because it's still not over. As a matter of fact, we will be learning for the rest of this year, I'm sure. But some of the lessons that I think that might be beneficial to you all is that you want to look for a team, because this is a project management initiative. I mean, this is a project that has to be managed from day one to the end. And basically, you have a timeline. You also have a lot of reporting responsibilities, and you're talking to a lot of people that have no clue what you're talking about. But when you ask them if you can bring a video unit to their facility, and they're going, "What's that?" So there's a lot of upfront education as well that had to go on. So you need the appropriate skills, and some of those obviously have to have a lot of project management background, I would think, a lot of technical background, a lot of customer service skills are included, and then just being able to self-manage your time, because again, our time was so limited during all this. Passion for the project. That's one of the things I can say about my team. Everyone in our team has a passion for this project. We envision what this will do for the state of Arkansas. May not be July 31st, but I guarantee you it will come. And the passion has to be there, or we would have never gotten this completed. Clarity of the project. That was a little bit, I think, something that I would suggest that probably needs to be done in a different manner, because there was a lot of things that we had to learn on the run, I guess is the best way to put it. When I talk about bringing this whole team in to do this deployment implementation, got 5 minutes? Oh, I'm still okay. Okay, thank you. I saw your red and I was going, oh no. But when we brought the team in to actually start this, there was one person that had actually worked for UAMS before. And I know when Adam told y'all that I'd worked in healthcare for 39 years, yes, I started when I was 1, but you know. But before coming to UAMS, I worked for Baptist Health, and I was telecommunications director for the system. And I will tell you that UAMS, is way far ahead as far as the telemedicine program. But several years ago, probably about the same time UAMS started the services for telemedicine, I actually tried to get Baptist to embark on the telemedicine. And you have to have those champions. You have to have the passion, and you have to have, as Brian said, the top down. You have to have somebody saying, yes, this is the right thing to do, and yes, we're going to go after it no matter what. And once you have that, there's no stopping you at that point. There are some, issues with reimbursement, and we're well aware of those, but I think we're just ahead of the time. It's got to come. We all know that there's healthcare's got to go through a lot of transition and change. Organizational insight, I mentioned that. One person out of our whole team was from UAMS, so I keep telling people I was still trying to learn where the restroom was, when we were putting together RFPs and things of that nature. And being in a large organization like UAMS, there are lots of hierarchies that you have to go through. So, if you can streamline that at all, that's very important, I would think. Sometimes you can, sometimes you can't. So you just need to, prepare for those types of things. Comprehending the governing rules and regulations. The federal grants have lots of rules and regulations, those of you who have participated in those. So just understanding those, and I will tell you that you can get 5 or 6 answers if you ask a question. It depends on who you ask. So, just learning those types of things as you go through is very important. Start with the end in mind. I think that is critical. We didn't have a lot of time, and we still don't. And sometimes Melinda keeps saying, just keep going, which is our motto, because you just have to keep going. You just have to keep moving to get this done. You have to set timelines, you have to set goals, and you have to make sure that you reach those goals, or you'll never get to the end. And also, when I talk about start with the end in mind, it's also what happens after the grant's over. We'll talk a little bit about that in a minute on sustainability. I'm so happy to see that people are looking for ways that they can jump on this network and use it and help them provide better services in this new healthcare environment. I think that is so critical. And we're hearing that, y'all. There's a lot of excitement out there. There's a lot of excitement. Obviously, I said aggressive timeline. It was, and I'm kind of jumping around, but that's pretty short time. Oh, I got 5 minutes. Okay. That's a pretty short time frame to put in as many circuits and things as we did. And we put in, just so y'all know, there are over 450 sites in this network. I've got my little data here, my little cheat sheets. We put in 267 broadband additions or increases, 9 co-location hubs for telemedicine. There were 16 backbone huts that had to be developed, 47 new fiber miles installed, 716 IRU miles, 290 public PCs, 495 interactive video units were installed. We had 370 GED meds installed in 223 STEFs. Those go on the clinical carts. Then we had other peripheral equipments that were not attached to the cart, like ultrasounds and adult rec cams and pediatric rec cams and colposcopes. And we also, I saw Nancy in here a while ago, we've also provided healthcare equipment for 15 sites that are part of the HCAA group. So we were very happy to be able to do that as part of this grant. And then I talked about the mobile virtual physician, which is the ambulance to ED. Flexible, you have to be flexible. We learned that early on. We've had to change our design, our network design, about 3 times now. So that's not an easy thing to do when you're going full blast. Management processes, you need those. Data management processes, you need those. Operational processes. The legal aspect, I was not from a state organization, so the legalities became very overwhelming to some degree, and they still are. So, but there's a lot of legal things that you have to be aware of. Audits, we've had 1 so far. We feel like we'll have at least 2 more, and probably 1 from the feds, because we were one of the largest awards, and y'all should feel very proud about that, from BTOP of all the states. Other duties as assigned, you know, it's not just deploying this network and implementing this, it's other things like speaking and doing outreach and things of that nature. Staffing considerations, you know, when you hire people and they're going to be here and you say, you know, this is a 3-year, 2.5-year project, they start getting nervous and start looking for jobs about, you know, 6 months before the end of the grant. So you've got a lot of knowledge base there, and making sure that they, you know, feel comfortable and can stay on board and that sort of thing is very important. And if they can't, what you're going to do, you have to plan for all those things. Central accountability and responsibilities. That early on was a lot of challenge, because there were things that were happening around that I was unaware of, and I think centralizing that's very important, because I might not know what the right hand was doing versus the left hand. So that's very important, particularly in making this timeline. Is it time? Okay. Anyway, you can move through this. I do want to show you. Oh, darn, I'm not going to be able to show you that. Okay, let me go through this. Okay, here's our network. I'll quit in just a minute. And this is the map of the network, where you see the black dots. That is the fiber backbone, and the red actually is the build of fiber. And then all of these little balloons that you start seeing is where all of our community anchor institutions are located and how they're connected back to the network. And we actually were able to have presence in all 75 counties within the state, which is a great idea. If you need to know where these locations are, go to our website. It lists them all. You can actually hover over a dot and know exactly what they've got. Again, it's here to be used, and that's just another map. Here are some websites. Our website is www.arkansasElink.com, and then, of course, we have Learn Telehealth, the American Telemedicine Org, and then Broadband USA is the overall project. So, and I have to put this up here because this is a federal program. And that's all. So thank you so much